Hi, I'm Charlotte. I'm going to be your nurse today. Can I see your wristband, please, dear? What is your name and date of birth?
Monica, 1/26/1998.
And can you tell me where you're at?
The hospital.
And what year is it?
2025.
And who is president?
Donald Trump.
And then the last question I'm going to ask you is, what is 1 + 1?
2.
Okay, based off that, I can tell that you are alert and oriented times 4, which is person, place, time, and situation. I can also tell that your cognition is good. She was able to add 1 + 1 is 2. Okay, so today, Monica, I'm going to be doing a full head to toe assessment. That was part of it. And right now, what I'm going to do is I'm going to use some hand sanitizer, put some gloves on, and I'm going to have you go ahead and take a seat at the edge of the bed. We're going to put on our gloves. There we go. All right, so like I said, this is going to be testing your different cranial nerves. Now the first one I'm going to start with is your second cranial nerve, which is your optic nerve. Now we're going to be testing basically the cranial nerves in your eyes. Now, the first part of this test I'm going to be doing is called confrontation, and then the second part will be utilizing that beautiful chart on the wall. All right, so first I'm going to have you cover your right eye with your right hand. I'm going to cover my left eye with my left hand. You're going to stay focused on my eye, that's it, and I'm going to hold up my hand with different numbers, and you're going to tell me what number you see, okay? All right, what do you see?
2. 1. 2.
All right, now we're going to cover your other eye. I'm covering my opposite. What do you see?
2. 1. 2.
That shows that that part of your cranial nerve is intact. For this next part, I'm going to have you stand up, bring your feet right here to the edge of the pillow. Okay, I'm going to have you cover your right eye, and I'm going to have you read the lowest line that you can on that chart.
428 365 WEM.
Now cover your left eye and read the lowest part.
374 258 EWE.
Now have both eyes uncovered and read the lowest line that you can.
374 258 EWE.
Now I'm going to go ahead and have you have a seat. Now, what I want to show you is when we're assessing this, we are assessing your focus of view, how far you can see. So right here, for when I asked you to cover your right eye and using your left one, you read this line here, which is 20/40 vision. Now when you covered your left eye and were reading with your right, it was 20/30 along when you had both. Now, next I'm going to be going on to 3 nerves that we're going to be testing. It's going to be your 3rd, 4th, and 6th, which is your oculomotor, your trochlear, and your abducens. And we are going to be using my pen light for all of these, okay? So for this first one, this is called the 6 cardinal gazes, field gazes. So what I'm going to do is look at the top of my pen light. Without moving your head, only using your eyes, you're going to follow this pen. You were able to do that, your cranial nerve is intact. Now, for this next part of the test, I'm going to turn out the light. Now, I'm going to have you look straight at me, and I'm going to be shining my pen light over, but keep your eyes on me, okay? I'm going to do each eye. Nope, on me. Okay, so for that part of the test, I was looking at your pupils to make sure they constricted, which they did. Now we're going to turn the light back on. For this part of the test, what I'm going to have you do is I'm going to have you look at the top of this pen light. This is from far away, I'm going to bring it towards your nose, and you're going to look at it. You might go a little cross-eyed, that's normal. Now, she was able to follow the pen light, which shows that that cranial nerve is intact, and also those 3 ones show us perla, which is that her pupils are reactive, they're round reactive to light and accommodation, which this is the accommodation. Also, as I'm testing that cranial nerves, I am looking at her eyes, and I can see that it's white, her conjunctiva and her sclera is white. She doesn't have any yellowness or jaundice or anything like that. Next, we're going to move on to the 5th nerve, which is the trigeminal nerve. For this one, it's doing sensation in the face. So what I'm going to do is be utilizing this cotton swab here. Now I'm going to have you close your eyes. I'm going to touch you with this, and when you feel it, you're going to say now.
No. 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 No.
That shows that her 5th cranial nerve is intact. Also, as I'm doing that, I'm seeing that her skin is intact. Her lips are pink. Feel the bridge of her nose. That's good. All right, next we're going to move on to the 7th cranial nerve, which is the facial nerve. Now, the way I'm going to test this is I'm going to have you open your eyes real wide, close them real tight. I'm going to have you grin. Now I'm going to have you frown and purse your lips. That is intact. Now we're going to go on to your 8th cranial nerve, which is going to be your acoustic. Sorry. Okay, so what I'm going to do for this is called the whisper test. So what I'm going to do is I'm going to cover one ear. I'm going to turn away from you. I'm going to whisper 2 words. You're going to repeat them back to me, okay?
Cow, boat.
Now the other one.
Cat, dog.
Perfect. That is intact. Now we're going to go onto your 9th intracranial nerve, which is going to be your glossopharyngeal. For this one, I'm going to use my tongue depressor. Now, for sanitary purposes, she did eat this popsicle. All right, so I'm going to have you open up, say ah, stick your tongue out, say ah, bringing it down. And for that one, I'm seeing that her uvula, which is a little dangly thing in the back of her throat, lifted up, which it did, so that's intact. You can put that back. Now we're going to be testing your 10th cranial nerve, which is your vagus nerve. Now, with that one, I've already heard you talking. You don't have any hoarseness in your voice. Now go ahead and swallow. And she swallows just fine, so that's intact. Now we're going to move on to the 11th cranial nerve, which is going to be your spinal accessories, is what it's called. So with that one, I'm going to have you shrug your shoulders. That's without resistance. Now I'm going to do it with resistance, which means I'm going to push, don't let me push you down. Good, that is intact. Now the last one is going to be your 12th cranial nerve, which is going to be your hypoglossal. So what I'm going to have you do is protrude your tongue out, stick it out, and then side to side. She was able to perform all those functions, so that's intact. Now, what I'm going to do is I'm going to change my gloves for the next part of this test. Just stay seated at the end of the bed. Throw that away. Use a little more hand sanitizer. The next test we're going to do is called the Weiner and Reiner test, and I'm going to be using this right here, which is my fork tong. Okay, so what I'm going to be doing is I'm going to hit this. It's going to vibrate. I'm going to touch you within. You're going to tell me where you feel when you feel the vibration more, which side. Okay. So the first one's going to be behind your ear, and that's the Reiner.
The back.
Okay. Next is going to be on your forehead. That's the Weiner.
The front.
Perfect. We set that there. I'm going to change my gloves one more time for the rest of the exam. Right. Now I'm going to start palpating the top of your head. I'm examining your scalp. Your scalp is intact. I don't feel any unusual bony prominences. Her skin on top is intact and her hair is evenly dispersed and clean. I'm gonna move on to feeling her ears. I don't see them open. Skin is intact. Her forehead skin is intact. I'm looking at your eyes. Like I said, your eyebrows are well groomed, intact. You have all your eyelashes. And I'm gonna do your orbital area. I don't feel any puffiness or any issues, no breakage in skin. Feel your sinuses, no inflammation in the sinuses, indicative of a sinus infection or anything. And now I'm going to move on to feeling your lymph nodes. In front of the ear, I'm just palpating with 2 fingers. I'm checking to see if any of her lymph nodes are swollen and hard, which they're not. Now behind the ear, base of the scalp, and down the sides of your neck, in the front and along the clavicle, which there's no signs of infection or any issues. Now I'm gonna go ahead and have you smile for me, and I'm looking at your gums. They're nice and pink. All of your teeth are there. Let me see the inside of your teeth. She has all her teeth, including her molars, no baby teeth. Looking inside, everything's pink and moist. I'm gonna look in her ears. There's a teeny bit of wax, but no issues besides that. A little bit of wax here, but just the normal. Skin is intact, no breakage, no redness, nothing like that. All right, now I'm gonna go ahead and I'm gonna assess your trachea. I'm gonna have you lift your chin just a little. I'm gonna take my middle finger and put it in the sternal notch. My 2 outer fingers here. I'm gonna feel it's midline. Okay, now I'm gonna put here. It's gonna feel a little uncomfortable. I'm gonna pull down and I want you to take a deep breath. That is called a tracheal tug. Hers is normal. Okay, for the next part of the exam, I'm checking out the rest of her skin. I can see it's all intact, normal on her legs, her arms. I'm gonna start assessing her pulses. So I'm gonna start here with her, oh, I itched my nose, let me change my gloves. All right. I'm going to start with her brachial. We're going to do her radial, her other brachial, and her radial. Now, as I was doing that, I was also assessing her respirations so that she wouldn't be aware, and she has 12 for respirations, which is a normal range. Now I'm going to go down here to her popliteal on both sides. And we're going to do her dorsalis and her tibial, both sides. I'm also going to assess her capillary refill, which is how quickly, when I press down on her nail, how quickly it goes from white back to pink. Less than 2 seconds. Less than 2 seconds. I can't assess on her nails because she has very beautifully painted nails, as we can see, but less than 2 means good perfusion. Also, I'm not seeing any edema in her legs or any edema in her hands or any redness or swelling. Also, no, they're not cool to the touch. It's not turning blue or anything, so she's not cyanotic. She's got good perfusion. All right, moving on. Oops, lost my pen there. Now we're going to move on to, I'm going to be assessing your carotid and temporal. So I'm going to palpate your temporals right here. And then I'm going to palpate your carotids. They have to be palpated separately because otherwise you can constrict blood flow to the heart and the person can pass out. So we're going to do this side and now this side. And then I'm going to go ahead and listen to it with my stethoscope as well, which before I touch you with my stethoscope, we're going to alcohol wipe this for sanitary purposes. I'm going to listen to your temporal, which they're 2+ in bounding. I don't hear anything unusual. Any unusual heart sounds like an S3 or a murmur. Good. Last thing I'm going to do when it comes to your face, as I've seen everything is intact, is I'm going to go ahead and check what's called your TMJ, which is right here. So I'm going to have you open and close. Did you feel any pain or anything?
Mm-hmm.
All right, everything's intact. She's good. All right, next, I'm going to listen. I'm going to feel and listen to your chest. Okay, so first I'm going to palpate. Do you feel any tenderness?
Mm-mm.
No tenderness. She's fine. We'll laterally palpate. I'm going to also percuss her chest. Nothing unusual there. I'm going to move on to the back. We're going to palpate and percuss. So I'm going to move this here. To the tops of the lungs, palpating. Nothing is hard, no inflammation, nothing unusual. Base, lateral, and now we're going to percuss. Nothing unusual there. Now I'm going to go ahead and I'm going to assess for tactile fremitus. So with tactile fremitus, when I'm going to place basically the sides here with my pinkies up against the different parts of her lungs, and I'm going to have her say 99. When she says 99, I'm going to feel a little bit of vibration. But if I were to feel extra vibration, that could be indicative of certain lung diseases. Okay. Say 99.
99.
Say 99.
99.
Say 99.
99.
And it's the normal amount of vibration. Now I watch the expansion of her chest from the front, but now we're gonna feel the expansion from the posterior, which is the back. So I'm gonna take the palms of my hands on the bottom of the scapula, and I'm gonna have you take a deep breath. And as you can see, my hands went in as she inhaled and out as she exhaled, so she has a normal expansion. I'm also gonna palpate her kidneys down here and percuss them. Do you feel any tenderness?
No.
Any tenderness?
Mm-mm.
That's a good sign. Her kidneys are good. Since I'm already back here, we're going to listen to all her lung sounds. Normally I would start in the anterior front, but I'm going to start with the posterior since I'm already back here. Go ahead, take a deep breath. Another deep breath. Another deep breath. Another deep breath. Deep breath. And one more. All right, now we're going to move to the front. And I'm going to listen to your chest. Just your breath sounds. Deep breath. Deep breath. Okay, for the next part of the exam, I'm going to be utilizing my stethoscope as well, but I'm going to be going through the different heart sounds. Now, what we should be hearing is S1, S2, which is called lobed up. That's your systolic and diastolic of your blood pressure, which is those two numbers, the top and the bottom. The top is when certain valves open, the bottom is when other valves open, being the aortic, pulmonic, tricuspid, and mitral. As long as they're all flowing good, you hear S1, S2. Now, if you're hearing S3, that can mean an irregular heart rhythm. And if you're hearing a murmur, it means a hole in the heart. Or some sort of regurg from a valve. So, when I'm listening to her sitting up, when I'm listening to you sitting up, my dear, I can hear your pulmonic and tricuspids and aortic valves very well. Also, with your pericardium, which your pericardium is the outer lining of your heart. If there's any issues with that, like swelling or anything, I can hear what's called a pericardial rub easier. Now, if I suspected anything, like if I thought you had an S3 or some sort of irregular heart rhythm, I would have you lay on your left lateral side, as the heart is more so against the chest wall, and I could hear it better. So, we're going to go through each of the sections of the heart, the valves, and I'm going to listen both with my diaphragm, which is the front part, and the bell, which is the back. So, I'm going to start with your aortic, which is going to be on your right-hand side. Here's the clavicle. It's going to be mid-clavicular line, second intercostal space. And we're going to listen to that. Now we're going to go to the left side, which is where the rest of the valves are heard from. The clavicular line, mid-clavicular, second intercostal space for the pulmonic. Then we're going to move down to the third intercostal space for what's called Erb's point. And then we're going down to the fourth for the tricuspid. For the last part, it's going to be on the lateral side, fifth intercostal space, and this is going to be what's called your point of maximum impulse, or apical. This is the apex of the heart, and it is the best place for getting an exact heart rate and hearing how strong the heart is. And hers is very strong. No abnormalities. I hear no S3s or murmurs, or S4s. Now I'm going to go back over it, listening with my bell. So I'm switching to my bell. Aortic, pulmonic, Erb's, tricuspid, and apical. Which hers sounds very good, very strong, healthy, no abnormal heart sounds. For the next part of this, I'm going to go ahead and have you lie down. And we're going to be lifting your shirt up for the exam. Now, this is the last part of her heart exam, right here with the apical, the point of maximal, the lateral, and fifth intercostal space. I'm going to palpate it which is strong, 2 plus bounding. And now I'm assessing it for anything like heaves or thrills or pulsations. So any abnormal things that I'm seeing, which I don't. Now we're going to move on to assessing her abdomen. So the first thing I'm going to do is inspect it. I'm seeing her skin is very intact in her midsection here. She doesn't have any obvious distension, swelling, any signs of that. Now I'm going to go ahead and palpate. Listen first. We are going to listen because if I palpated first, it could cause her digestive tract to jumble around and cause abnormal or not right here. Oh, change it back. Which I can hear right now. She has very hyperactive bowel sounds. Now I'm going to feel right here on her right hand side for her liver. I'm not feeling any distension, swelling, hardness. I'm going to go ahead and palpate your abdomen now in all 4 quadrants. Are you feeling any tenderness when I'm doing that?
No.
There's no hardness, crepitus, distension. Everything's normal. Now I'm going to percuss. Any tenderness?
No.
That still feels okay?
Yes.
Okay. Now I'm going to go ahead and have you sit at the edge of the bed. For this last part of the exam, we're going to be going over range of motion and making sure all your joints and muscles are working good, okay? All right, so for your neck, we're going to start with that. I'm going to have you do flexion. Bring it back up. This is called hyperextension. I'm going to have you go laterally bend. And we're going to end with some rotation. And I can see you have full range of motion in your neck. Now we're going to move down to your shoulders. All right, then we're going to do what this is called abduction, which is going towards your body. Then we're going to do internal rotation and external rotation. Very good. Now we're going to go to your elbow. You're going to do flexion, extension, other side. And now with both elbows, we're going to do supination, pronation. Now bring them down. Now wrists. Bring your hands like this. And do flexion, extension. Now keep your hands like this, fingers, flexion, extension. Wonderful. Okay, now we're going to move on to your knees. I want you to extend the knee, extension, other knee. And as you brought it back, that was called flexion, which you have. Now we're going to move on to your ankles. For your ankles, you're going to do both sides. We're going to do, this is called the dorsiflexion, upwards, and plantar flexion going down, like your foot. Now for your foot, we're going to do eversion, going inward, and inversion, and other side. Okay, all right. Now I'm going to have you stand, and we're going to assess your hips. I'm going to have you hold on to my hand for safety reasons. You're going to bring this one here, which is your left. I'm going to have you do abduction, abduction. Now other side, abduction, abduction. Now we're going to do each side. We're going to do internal rotation, external rotation, internal, external for your other side. Now I'm going to have you turn to the side, and what we're going to do is we're going to be bringing this leg back kind of as far as it can go, keeping your upper body straight. Okay, now the other side. And that's hyperextension of the hips. Now turn back towards me. I'm going to go outside so we don't bonk heads. We're going to do your vertebral column, which is your spinal cord. Okay, so you're going to do flexion going forward, come back up, hyperextension, extending it slightly back further than it can. We're going to do lateral bends, and then we're going to do rotation. And I can tell all of that is intact. Now go ahead and have a seat. So this is the end of my exam. I'm going to take the allotted 5 minutes to look at my notes to see if there's anything that I missed and need to go over. So that will be it for this head to toe examination. Thank you, Monica, for being such a wonderful participant.